Inside the human body lies a city that never rests, the lymphatic system. A vast network of vessels, nodes, and immune cells working together to protect the body. In a healthy immune system, lymphocytes follow strict rules of growth, division, and programmed cell death, a process called apoptosis.
Checkpoint clear. No pathogens detected today.
Good work, Luma. Remember, divide only when instructed and self-destruct when your job is done. But sometimes things go wrong.
I don't feel the shutdown signal anymore.
Luma, report for apoptosis.
Why should I? I can keep going. Non-Hodgkin's lymphoma begins when genetic mutations disrupt normal lymphocyte regulation.
A chromosomal translocation has occurred. Anti-apoptotic proteins activate. Growth signals remain permanently switched on. The cell no longer obeys immune control.
No Reed-Sternberg cells detected. This confirms non-Hodgkin's lymphoma. The abnormal lymphocyte divides uncontrollably, replacing normal lymphoid tissue.
Lymphomas developing in the lymph nodes are known as nodal lymphomas, and when they are in other tissues or organs like the skin, they are called extranodal lymphomas. As the malignant lymphocytes continue to divide, the city begins to fracture.
Not all of these abnormal cells behave the same, and not all originate from the same lineage.
The checkpoints are swelling! Energy levels dropping!
Clinically, patients develop painless lymphadenopathy, fatigue, and immune dysfunction. Fever, night sweats, and unexplained weight loss, known as B symptoms, signal systemic disease progression. Patients may present with gingival or palatal swellings, non-healing ulcers, unexplained tooth mobility, or facial asymmetry. Often, a dentist is the first professional to suspect malignancy. CD20 positive, B-cell origin confirmed.
This table presents selected types of non-Hodgkin lymphoma, focusing on their cell of origin, grade, key features, and clinical associations. Starting with diffuse large B-cell lymphoma, is an aggressive malignancy characterized by rapid growth of large abnormal lymphoid cells. It may arise de novo or develop from transformation of a lower-grade lymphoma. Clinically, it presents with lymph node enlargement and may involve extranodal sites such as bone, leading to extensive destruction. Histologically, this tumor consists of sheets of large lymphoid cells with abundant cytoplasm, often accompanied by reactive histiocytes. This lymphoma is often associated with chronic inflammatory or autoimmune conditions such as Hashimoto's thyroiditis, Sjogren's syndrome, and Helicobacter pylori-related gastritis. Next is follicular lymphoma, which is also a B-cell lymphoma, but in contrast, it is indolent.
A chromosomal translocation has occurred. Chromosome 14 has fused with chromosome 18. This translocation, known as T418, results in overexpression of the BCL2 gene. Approximately 85% of non-Hodgkin's lymphomas arise from B lymphocytes, making B-cell lymphomas the most common subtype.
Burkitt lymphoma is a highly aggressive B-cell lymphoma characterized by extremely rapid growth and a classic starry sky histological appearance. It is driven by a MYC gene translocation, most commonly T814. There are different clinical variants of Burkitt lymphoma. The endemic form occurs in equatorial Africa and is strongly associated with Epstein-Barr virus infection. It commonly involves the jawbones and may also affect organs such as the kidneys, liver, and gonads. The sporadic form typically affects young adults and often presents as an abdominal mass with possible bone marrow involvement. Jaw lesions are less common in this type. In immunocompromised patients, particularly those with HIV, Burkitt's lymphoma may involve lymph nodes as well as extranodal sites such as the central nervous system, bone marrow, and gastrointestinal tract. Radiographically, lymphomas affecting the jaw appear as poorly defined radiolucent areas, often associated with cortical expansion, erosion, or even perforation. Moving to MALT lymphoma, also known as extranodal marginal zone lymphoma, this is an indolent B-cell lymphoma that arises in mucosal tissues, most commonly the stomach. It is strongly associated with chronic infections, particularly Helicobacter pylori. Extranodal marginal zone lymphoma is an indolent type that arises in mucosal or extranodal tissues, including the gastrointestinal tract, salivary glands, thyroid, and skin. Nasofacial NK/T cell lymphoma is an aggressive and destructive condition affecting the midline facial structures. It causes progressive ulceration and destruction of the palate, nose, and surrounding tissues, and may lead to the formation of oroantral fistulas. Microscopically, this tumor shows areas of necrosis in granulation tissue, along with atypical lymphocytes displaying irregular nuclei. Angiocentricity and epitheliotropism are characteristic features. Granulocytic sarcoma is an extramedullary tumor associated with myeloid leukemias. It may present as a localized oral soft tissue mass and can occur in patients with acute or chronic myeloproliferative disorders, or even as an initial presentation.
Initiate R-CHOP chemotherapy.
Rituximab targets malignant B cells. Radiotherapy may be used in localized disease, while refractory cases may require stem cell transplantation.
I was meant to protect, not destroy.
Early detection changes everything.
In the lymphatic city and in oral pathology, noticing the abnormal can save many lives.